How does our body regulate blood pressure? That was a question I got the other day, and I want to answer it for you using Twisty balloons. Now, before we get going, what is blood pressure? Blood pressure is the pressure that the volume of blood inside our blood vessels, the arteries and veins, exerts on the walls of those arteries and veins. Blood pressure is needed so that our blood and everything that it's carrying, the oxygen, the nutrients, and so many other things, get to where it needs to go in the body. Blood pressure is really caused by the contractions of the heart. As the heart squeezes, blood goes up and through the aorta and throughout other vessels in the body so that our blood goes to where it's needed. Now, our blood pressure needs to be within a certain range. If it's too low, that's a problem. If it's too high, that's also a problem. So our body regulates that blood pressure and tries to keep it in that nice sweet spot. Now, how does it do that? We're going to talk about three main ways that our body regulates blood pressure. There are others, but we're going to classify them and group them into three main ways. And these are the ways that you would talk to about it with your doctor, with drugs or with other natural substances, treatments, modalities that you can use to regulate the blood pressure. So first, the first way that our body regulates blood pressure is through our sympathetic nervous system, or nervous system generally. Our nervous system includes our brain, our spinal cord, and all of the other nerves in our body. So, to remember that, I like blue for nerves. That works really well for me. We're going to remember that our nervous system is involved with controlling blood pressure. So, we're going to use this nifty hat thingy. Inside our brain is something called the hypothalamus. Our hypothalamus has a collection of neurons that help regulate our blood pressure. So that's what is largely doing it, although there are other influences throughout our body as well. From a pharmacological perspective, if you were to take blood pressure medicines that target the nervous system, you would take something called beta blockers. These drugs include metoprolol and atenolol and propranolol, things like that. And they are really blocking the effect of that nervous system regulates the blood pressure. That's the first one. The second one is through our kidneys. Kidneys are two organs. They're about the size of our fist. They sit kind of in the back on the sides of our body. The kidneys, among many other things, they help regulate the volume of water and salt and other things inside of our bodies. So we're going to explore that here with this balloon. Okay, so this is a rough depiction of what a nephron looks like inside your kidneys. Nephrons are like microscopic little structures inside your kidneys, and their main job is to help kind of regulate how much blood, water and salt is in our urine. So up here, you can imagine that this is surrounded by blood vessels in a spaghetti strainer type contraption. In that contraption, called the glomerulus, our blood is filtered, a lot of water, a lot of salt, sugars, other protein, those small molecules go inside the inside of the nephron. And our body's like, wait, we need to keep those, so a lot of those are reabsorbed back into the blood. Then it goes down through what's called the loop of Henle, down to this area, and then out through the collecting duct into our urine. Now, through each of these stages, there's a series of doors that open and close and regulate the flow of water and salt in and out of the nephron. Now, there's lots of ways that is regulated, and by controlling the amount of salt and the amount of water in our kidneys through our nephrons, we're able to control the blood pressure. If we keep a lot of water inside, we're sending a lot of it out down through our urine, then we're going to get rid of water and it's going to lower our blood pressure. If we keep a lot of water, we're going to increase that blood pressure. You can imagine if this was filled with water instead of air, that water, if there's a lot of it, it's gonna swell. It's gonna cause it to bulge. Now, if there's a little bit of water, it's gonna be kind of floppy. It's not gonna have as much pressure. So that's what you can think of is a water balloon versus an air-filled balloon. This is a rough depiction of the nephron. There's different drugs that act on this, and often these are called diuretics. Diuresis is the process of urinating, of getting rid of liquid from our body. And by acting on the loop of Henle with something called like furosemide, acting on the distal convoluted tubule with something called thiazide diuretics, like hydrochlorothiazide, we can regulate the flow of those doors that open and close that let water in and out of our bodies. That is our nephron. So the third way that we can regulate our blood pressure is through our blood vessels themselves. So this is representing an artery carries blood from our heart to the rest of our body. Now, throughout our arteries, there's a thin layer of smooth muscle, that can contract and relax. So when it contracts, it's increasing the blood pressure, and when it's relaxing, it's decreasing that blood pressure. This is happening through blood vessels all throughout our body. Now, when we're able to control that through the regulation of calcium. Calcium is involved with muscle contraction. So by controlling calcium, we're able to control how much pressure the muscles are exerting on the blood in our blood vessels. So those are referred to as calcium channel blockers. Verapamil and nifedipine are some of those that are often commonly prescribed by conventional doctors, cardiologists, and so forth. Now, you've heard me talk about lots about different drugs. Can we use drugs for regulating blood pressure? Yes. Is that needed sometimes? Yes, especially in maybe an emergency situation when our blood pressure is really high. We want to lower it so it's not so dangerously high. We often use those drugs. Now, but wait, Dr. Smith, Dr. Michael, you're a naturopathic doctor. Is there other natural things that we can use to regulate our blood pressure? And most definitely the answer is yes. There are a lot of lifestyle things that we can look at. We can explore diet, looking at the salt content as it applies to the nephron, and the amount of salt that we're eating is one way that we can do that. We can look at botanicals. There are a lot of botanicals that act as diuretics, that act to strengthen the heart muscle itself, and that help regulate the body as a whole. And there's a lot of other homeopathics, lifestyle, physical activity, movement, things that we can do to strengthen our heart, to help lower our blood pressure, and lower the risk of other consequences that high blood pressure has on our end organs, our lungs, our liver, our kidneys, and so forth. So these are the three main ways that our body regulates blood pressure. Number one, our nervous system. Number two, our kidneys. And number three, our blood vessels. And through all of these, and we can make sure that our blood pressure is in that perfect healthy range as much as we can.